Hello, my name is Jordan. I'm going to be your nurse today. How are you doing?
Good, Nurse Jordan. Thank you. How are you?
I'm good. Okay, so today we're going to be focusing on the heart, the cardiac system. So I'm going to ask you some questions and we'll do a quick assessment, okay?
Sounds good.
Okay, perfect. Okay, so just to start off, have you recently had any chest pain or chest tightness?
No.
Have you had any other type of pain, just anywhere in general?
No.
Okay. Any palpitations?
No.
Do you drink any coffee, pop, energy drinks, pre-workout, anything along those lines?
Yes.
Okay, what do you drink?
I drink energy drinks and pre-workout.
Okay, how often do you drink those?
Pre-workout every day before I go and work out, and
Okay.
energy drinks maybe twice a week.
Twice a week? Okay. Do you ever feel like your heart is beating like super fast or anything out of the ordinary? Just
No.
helps gives you a little boost of energy?
Yeah.
Okay. Do you feel any shortness of breath?
No.
Do you ever feel stressed?
No. I never get stressed.
Even when
Never ever.
Even when you're like late on your homework and you're up.
Maybe when I'm late on my homework, I feel a little bit stressed.
Okay. How many pillows do you use when you sleep?
2.
Okay. Do you have a cough?
No.
Okay. Do you easily get fatigued?
No.
Are you able to keep up with your family and your coworkers?
Yes.
Okay.
I'm ahead of them most of the time, by the way.
Okay. Have you ever noticed your skin, especially on your face, ever turning blue or an ashy color?
Mm-mm.
Do you have any swelling in your feet or legs?
No.
Do you ever feel the urgent need to urinate at nighttime?
No.
Okay. Okay. Any history of hypertension, high cholesterol, high triglycerides, heart murmurs, congenital heart disease, rheumatic fever, or unexplained joint pain as a child?
No.
Do you have any family history of these?
No.
Okay. Have you ever had anemia?
No.
What about any type of heart disease at all?
No.
Okay. Have you ever had an EKG done?
I have, yes.
You have. Can you tell me what that was for?
It was for right when I got done with COVID and got over COVID. The athletic department made athletes go back and get an EKG before they could return to play. So
Okay.
I had to go do that.
What were the results?
They were normal.
Normal. Did you have any other lab work done for it, for that?
I don't believe I did.
They didn't draw your blood and test for anything?
Maybe they did, yes.
Okay, I think they probably tested for your troponins.
Oh, yes, troponins.
And those results came back normal as well?
I believe so, yes.
Okay. Let's see. Do you have any family history of obesity or diabetes?
No.
Okay. Can you describe to me your usual daily diet?
In the morning I usually have a cereal, like a Special K cereal, or
Okay.
I try to eat eggs and sausage or eggs and bacon or something like that, something high in protein.
Okay.
For lunch I usually do something a little bit smaller, like a chicken wrap or some rice and chicken. And then for dinner usually just any type of meat, a veggie, and a grain.
Okay. Good. You generally try to keep it pretty healthy?
Yeah.
Do you snack at all during the day?
Occasionally, but I'm not a big snacker.
Okay. Let's see here. What would you say your usual weight is?
Around 225.
Have you had any recent big changes or fluctuations at all?
No.
Okay. Do you smoke any tobacco products?
Yes.
What do you smoke?
The occasional cigar or pipe.
What age did you start doing that?
When I turned 18.
Okay. And then about how often do you smoke cigars?
Maybe once every 2 months.
Okay. Have you ever tried to quit doing that or?
No.
No? Okay. How much alcohol would you say you drink a week?
I only drink on the weekend, so Friday or Saturday.
Okay.
And usually have anywhere from 2 to 6 drinks on those nights.
In a setting?
Yeah.
And when was your last drink?
Saturday night.
Okay. Have you ever been told that you have a drinking problem?
No.
Okay. What would you say your usual amount of exercise is each day and then or per week, or what would you say?
I probably work out a total of like 7 times a week.
Okay.
And usually like one big workout a day, if not every other day. I'll do like a small workout in the morning and then a bigger workout in the afternoon.
Is that related to your you're a college athlete, correct?
Yes.
Okay. Are you taking any type of heart medications like a calcium channel blocker, any medicine for hypertension, any aspirin, diuretics, anything along those lines?
No.
Okay, awesome. All right, well, I'm gonna go ahead and get started on the assessment, okay?
Okay.
Okay. Okay, first I'm gonna get your blood pressure here. All right, sounds great. Looks like about 110/70.
Is that good?
Mm-hmm. Yeah.
Great.
All right, I'm gonna feel. You can keep your arm there. I'm gonna feel your radial pulses here and get your heart rate. Okay, those feel great. And looks like your pulse is about 54.
Nice.
Do you normally run on the lower side of
Yeah.
the? Okay,
Yeah.
so normal is about 60 to 100, but I know that you're an athlete,
Mm-hmm.
so resting heart rate can be a little lower when you're just at rest.
Sure.
Okay, let's see here. Okay, I'm gonna go ahead and feel your carotid arteries
Good.
here. Perfect.
Nice.
We'll go to your brachial arteries. Great. Okay, we're gonna skip your femoral arteries today,
Yeah.
but I'm gonna go straight down to your popliteal arteries.
Okay.
Here under your knees. Sometimes they're a little hard to feel.
Mm.
All right, I'm gonna feel your pedal pulses down here by your feet or on your feet. Feels great. All right, go ahead and now we're gonna take a listen
Okay.
to all of your different artery and heart sounds here.
Do I need to move him? Do you hear me?
What?
Do I need to move him?
No, he's okay for now. Okay. Nice and strong.
Thank you.
Okay, last thing, I know it's going to be a little hard. I mean, if you can, I'm going to have you lay down on the couch for
Okay,
me.
I can do that.
Yep. Perfect. I'm going to go ahead and feel your chest here. I'll pick your chest. Kind of do it around this little guy. Any pain at all?
No.
Good. I'm going to feel for your apical pulse here. It's the strongest point of your heartbeat.
Mm.
All right, and then we'll just go ahead and take a listen to it. Great. Okay. All right, I think that's about all I got for you.
Great.
So I think what we're going to focus on is, I know it's not anything unhealthy, but technically there's some bradycardia because your heart rate is below that 60 beats per minute.
Mm.
However, that is super common for high intensity athletes for their heart rate to be lower than 60 at rest. So nothing to worry about there. Just going to focus on that as a diagnosis. Other one we're going to focus on is, I know that you have great blood pressure.
Mm-hmm.
Sometimes when you're under stress, your blood pressure can rise. So we'll just do a little bit of education on hypertension.
Mm-hmm.
The last thing we're going to do some education on is cardiomyopathy. Now, the reason that you got those cardiac tests done when you got COVID is because a lot of athletes have been getting, not a lot, but a percentage of athletes have been getting cardiomyopathy after they get COVID, and it's been causing some really scary issues. Some have even resulted in cardiac death. And so that's why they had you do the EKG and the lab work and all that stuff, just to make sure you were good to return to practice before anything bad happened. So I know that your results were normal, and that was over a year ago, but we'll just focus on that for a diagnosis, okay?
Great. Sounds good.
Okay, well, I will see you next time.
Thank you so much, Nurse Jordan.
Yep, you're welcome.